everyone. Good afternoon, ma'am. This is Dr. Manisha. I'm working as a medical lead in the Medical Affairs Division of UPIN. So, on behalf of my team, I would like to give you a warm welcome in this discussion where we are going to discuss about the women's health and also the associated psychiatric conditions seen in women with some gynecological condition, like, for example, PCOS here in this case. As we are aware that women are quite vulnerable to the psychiatric conditions, and especially those women who are having some gynecological conditions like PCOS, which is very common in Indian setting. If you see, PCOS is becoming very more common and common among women, particularly in young age, very middle-aged women. And also there is increasing evidence also that they have been associated with psychiatric elements associated with them. So, ma'am, I would like to take your views and opinion. What are the commonly observed psychiatric condition in such patients?
Thank you, madam. So PCOS is a very common terminology which is used now and then, and we see that many young girls, teenage girls, are suffering from this disorder. So mainly it's a lifestyle disease. It's a lifestyle disorder because of the faulty lifestyle that we are living nowadays, and therefore the psychiatric ailments are also common in this disorder because we are not taking care of our physical health as well as our mental health. So commonly seen is anxiety disorder, comorbid depression with PCOS. That is all because of the low self-esteem and the hormonal changes which start at teenage girls, and also because of the other symptoms of PCOS, that they have hirsutism, they have body hair growth. There is that also impairs their self-esteem, and therefore they suffer from these diseases.
Thank you, ma'am. Thanks a lot. This very valuable information you have shared, which is in the practical aspect, is very important. So in epidemiology, if you see certain clinical studies, they say that there is a high prevalence of anxiety and depression, and it was also reported in such subset of patients. So this indicates that there is increasing need of mental health expert in such subset of patients. So would you like to give us that information that women with PCOS are generally should be advised when they should be advised to consult the psychiatrist or mental health experts?
Okay. It's a very important question because people generally nowadays are unaware about the psychiatric symptoms, or they go to a doctor only when they have physical ailments. So basically, when there are any sleep disturbances, not able to eat food, the appetite is poor, or there is equally appetite is more, or they are sleeping more. Whenever they feel sad or they feel low in confidence, they do not feel like going out or interacting, or do not feel like how they would pleasant, do not feel pleasant as they would feel before. They are constantly worried, and constantly they have thought ruminations about trivial issues, get irritable on trivial issues. They suddenly burst out, or there is excessive irritability. Or there are also eating disorders sometimes which start at this age, body self-image related issues, when they are not confident and they feel sad about their body image, about their self. So when these thoughts are in excessive and they are continuously disturbed with these thoughts, or negative thoughts, or low self-confidence, when it is persistent and it is for a long period of time, say about 1 to 2 weeks continuously, and the patients are not able to concentrate on their work, on their daily routine, then definitely they must visit a psychiatrist. They feel like crying, they feel like sometimes ending their lives, suicidal thoughts. Definitely you can get adequate help from a consultant psychiatrist or a doctor or whoever is available nearby, any counselor. So you can meet them who can guide you if at all necessary, if you need any treatment. So any sudden change in the behavior, you should go and visit a psychiatrist.
Right. Okay, thank you, ma'am. There is another aspect associated with it. If you see, these two conditions are so closely associated with each other. There are certain clinical applications when patient is suffered with PCOS. Similarly, do you feel that is there any repercussions in patients who are suffered with mental illness in that PCOS patients? Like, for example, these patients are having infertility related issues or something menstrual irregularities, difficulty in conceiving, that leads to mental awareness but mental problems, and this psychiatric illness, do you feel that is there any repercussions in the real life of these patients?
Yes, definitely. Because of infertility related issues, as I said, there is hirsutism, that is, there is growth of hair in the chin area. And also there is obesity, which is a very important symptom of PCOS. And definitely it is going to affect their mental health, because of there is a low self-esteem due to these issues. There is also a distorted body image related issues, which can have issues like anxiety and depression. And then they do not, because of these psychiatric illnesses, like because of anxiety, because of depression, they do not have, they are not in good mood, or they are sad, and they do not feel like doing anything actively to take care of their own self or to come out of this illness or do something actively. That is because, so it's a vicious cycle. Because of PCOS, because of the hormone related imbalance in the body, it leads to psychiatric illnesses like depression. And depression in turn makes them, they do not feel like doing anything actively about it, because they have lost interest in the things. And also there is a feeling of hopelessness that they won't get better, or they cannot lose weight, or they have to live like this. So because of this, they again do not actively even take treatment for PCOS, or do exercise or diet modification or lifestyle modification, which is necessary to take care of that. And therefore they get into that vicious cycle, and therefore it is hazardous.
Yes, ma'am. Yes. So all viewers, I would like to say that we have Dr. Sampada Raikar, who is very well-known psychiatrist. So, ma'am, you must be coming across so many patients who are having this mental illness along with some gynecological disorder. So, do you feel like what is your final message for these women who are suffered with PCOS and who are also struggling with depression and anxiety? Any last, some concluding remark from your end?
The only concluding remark I would say is, you have to speak up and seek help. So, because people are unaware about their illness, and therefore you should be aware that something is wrong with your body, and you should seek help. You should speak up. Speak up with your friends, family, and necessary whoever is available in and around, any counselors, any psychologists. You can just speak up, who can guide you, or psychiatrists who are there in and around you. Go and meet them, speak up, seek help is the only concluding remark I would say, because you need to come out of that trap and that vicious cycle, and therefore seek help and speak up.
Really very very great message, very important and valuable also for all of us who are one of the other time have such kind of episodes, but because of only unawareness, people are not disclosing, they are getting suffered with some of the other mental illness. So, with this, I would like to give my heartfelt thanks that in your busy schedule you have taken time out to discuss this issue with us, and I am really grateful to you for entire this information and conversation what we have. So with this, I will wind up the session. Thank you very much, Dr. Sampada.
Thank you so much.